obesity has increased over the past 20 years. 20
Mm-hmm.
years ago, we didn't have all these obese people.
And that is one of the major factors, you would say, dealing with diabetes.
Yes.
That if we could really do something to control our weight, just for the sake of health, and health alone, that would impact how much we pay for these in order to deal with this disease.
Yes, yes. It would definitely help.
And so it would be cost effective in a real sense to go as far as we possibly can to eliminate it. Now, Meharry Medical College also is associated with a clinic. Is it not a diabetic clinic where you?
Yes, we do have diabetic specialists at Meharry.
Well, you also, I think at one time you talked about having a center there for people who have to go on dialysis and et cetera. Why don't you say something about that center and how it's supported?
For dialysis, so if you end up on dialysis, if you end up with end organ damage from diabetes or any other disease and you end up on dialysis, yes, we do have a chronic dialysis center at Meharry. It's a partnership with Dialysis Clinic Incorporated and Meharry Medical College, and we have a center right there on campus, and it's a very nice center.
And it's open to people in the general area?
Oh, yes.
It's open to anybody who would like to come in, or is there some kind of special kind of health insurance that they have to have in order to take advantage of the...
Yes, all patients must have some form of coverage to be in the center. The state does not pick up coverage unless you're under TennCare, okay, and the federal government picks up your coverage if you're under Medicare. But the cost of dialysis for a person to pay for it out of their own pocket is tremendous, so that's almost impossible to do. So you have to be covered in some form of fashion.
You got to have some kind of coverage in order to be served in reference to that. And those individuals who might just so happen not to be covered, they're sort of what?
They get coverage.
There's always something, there's always a stopgap in a real sense.
Yeah, if you're a citizen of the United States, then the United States certainly covers you through the state or federal funds.
So very good. And so there's a recognition on the part of the government that some individuals, even though, and we often hear people talk about people who don't have health coverage and et cetera, but if your health is of such that you really need this in order to survive, that there is always a possibility of somebody coming to your aid.
And we have people in place at Metropolitan Nashville General Hospital as well as the dialysis unit to help facilitate that coverage.
Very good. So and so the medical community is doing almost as much as they can possibly do in terms of trying to curb this disease, but without the assistance of individuals themselves, then there's not that much we can do.
Yes,
is that a correct assessment?
Yes.
But that if an individual believes that he or she might be drifting toward that there are some things that you've indicated that they can do, because if they don't do these things, then the possibilities of them ending up on dialysis and et cetera is very great.
Yes.
So is that,
yes, it is. It's very great.
Very good. And of course, Dr. Faulkner, we've got about a minute and a half before we end this show for today, but do you have any final comments that you'd like to make in reference to some of the things that we've talked about?
Well, you know, I think that we should watch our weight. We should exercise more. We shouldn't supersize. We should watch the fast foods that we eat and try to cut back on them. Eat fresh fruits and vegetables to prevent diabetes. If we have diabetes, then we should certainly monitor our blood sugars very closely. We should visit the doctor regularly. And we should make sure that we get our eyes examined have eye examinations once a year. Make sure we visit a dietitian or get some kind of diabetic counseling at least once a year. So we have things that we should do. We should monitor our cholesterol and our lipid levels once a year. So there are things that we should do, and certainly we should monitor our kidneys every year.
And so if an individual is really concerned about his or her health, and they understand the possible outcomes, if they are not conscientious in terms of trying to deal with some of the problems, then it's really up to them. It's very little that you can do as a physician. The only thing you can do is deliver the message, but if they don't accept the message, then there's very little that anybody can do. That's right. Okay, well, I appreciate, Dr. Faulkner, the information that you've given us. Again, I believe that it is an excellent piece of information. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.
News, weather,